Every year, millions of people around the world are prescribed antidepressant medications. These drugs alter brain chemistry, often come with difficult side effects, and can take weeks to show results. But what if a small yellow flower growing wild in meadows across Europe and America contained compounds that work in a remarkably similar way? For centuries, this plant was dismissed as a common weed. Farmers considered it a nuisance because it was toxic to their livestock. Yet today, in Germany, doctors prescribe it more often than Prozac. Scientists have discovered that inside its golden petals lies a molecule that influences the same brain chemicals targeted by pharmaceutical antidepressants. This is Hypericum perforatum. You probably know it by its common name, St. John's wort. And the science behind it is forcing modern medicine to take a very old remedy very seriously. The name itself holds centuries of history and mystery. St. John's wort typically blooms around June 24th, the feast day of St. John the Baptist. Medieval healers believed the plant held supernatural powers against evil spirits and melancholy. They hung it in doorways to ward off demons. They burned it in midsummer bonfires. They gave it to people suffering from what they called dark moods. What those ancient healers could not have known was that the plant they were using actually contained psychoactive compounds, molecules capable of crossing the blood-brain barrier and altering human brain chemistry. They attributed the effects to magic. Modern science has a different explanation. St. John's wort belongs to the plant family Hypericaceae. It is native to Europe, Western Asia, and Northern Africa, though it now grows throughout North America and Australia as an invasive species. The plant thrives in disturbed soils, roadsides, pastures, and abandoned fields. It grows between 1 and 3 feet tall, producing clusters of bright yellow flowers with 5 petals each. If you hold a leaf up to the light, you will notice tiny translucent dots scattered across the surface. These are oil glands containing the plant's bioactive compounds. The Latin name perforatum refers to these perforations. Both the flowers and leaves are used medicinally. They are harvested at peak bloom when the concentration of active compounds is highest. The fresh flowers release a distinctive red pigment when crushed. This blood-red oil was considered a sign of the plant's healing power by medieval herbalists. The chemistry of St. John's wort is where things get truly fascinating. Scientists have identified at least 10 distinct bioactive compounds within the plant. 2 of them have received the most research attention. The first is hypericin, the compound responsible for that blood-red pigment. Hypericin is a naphthodian throne, a complex molecule with documented effects on the nervous system. Early research focused heavily on hypericin as the primary antidepressant agent. However, current scientific understanding has evolved. The second major compound is hyperforin. Hyperforin is now believed to be the primary driver of the plant's antidepressant effects. This molecule has a unique mechanism of action that distinguishes it from other natural compounds. Hyperforin inhibits the reuptake of multiple neurotransmitters simultaneously. Most pharmaceutical antidepressants target 1 or 2 neurotransmitter systems. Selective serotonin reuptake inhibitors like Prozac focus primarily on serotonin. Hyperforin affects serotonin, dopamine, norepinephrine, GABA, and glutamate. This broad-spectrum activity may explain why St. John's wort produces antidepressant effects comparable to prescription medications. Additional compounds include flavonoids like quercetin and rutin, which provide antioxidant and anti-inflammatory effects. The plant also contains tannins, essential oils, and xanthones that may contribute to its overall therapeutic profile. When St. John's wort compounds enter the human body, they initiate a cascade of neurological effects. The most significant action occurs at neurotransmitter reuptake sites. Under normal circumstances, after a neurotransmitter like serotonin is released into the synapse, it is quickly reabsorbed by the sending neuron. This process terminates the signal. Hyperforin blocks this reabsorption process. As a result, neurotransmitters remain active in the synapse for longer periods. This increases the overall signaling between neurons. The effect is particularly pronounced in brain regions associated with mood regulation. The prefrontal cortex, hippocampus, and limbic system all show altered activity patterns. Over time, this enhanced neurotransmitter activity can alleviate symptoms of depression. Patients typically report improved mood, better sleep, reduced anxiety, and increased energy. The effects are not immediate. Like pharmaceutical antidepressants, St. John's wort typically requires 2 to 4 weeks of consistent use before benefits become apparent. This delay suggests the mechanism involves gradual changes to neural receptor sensitivity rather than immediate chemical effects. Beyond mood, St. John's wort demonstrates anti-inflammatory and antiviral properties. Hypericin has shown activity against certain viruses in laboratory studies. Some research has explored its potential against herpes simplex and even HIV, though clinical applications remain distant. The pharmaceutical story of St. John's wort centers primarily on Germany. German physicians began systematically studying the plant in the 1970s and 1980s. Rigorous clinical trials compared it directly against established antidepressant medications. The results surprised many in the medical establishment. For mild to moderate depression, St. John's wort performed comparably to prescription drugs. In some studies, it actually showed fewer side effects. Based on this evidence, German regulatory authorities approved St. John's wort as a prescription. Treatment for depression. Today, German doctors write millions of prescriptions for standardized St. John's wort extract annually. The most studied formulation is known as LI 160 or ZE 117. These extracts are standardized to contain specific concentrations of hypericin and hyperforin. In the United States, the FDA classifies St. John's wort as a dietary supplement rather than a drug. This means it is available over the counter without a prescription. However, this also means product quality and potency vary significantly between brands. American consumers must be careful to select products from reputable manufacturers who follow good manufacturing practices. The World Health Organization recognizes St. John's wort as a treatment for mild to moderate depression. Several other European countries have followed Germany's lead in approving it for medical use. The cosmetic industry has found applications for St. John's wort extract in skincare formulations. The anti-inflammatory properties make it useful for soothing irritated or damaged skin. Traditional herbalists have used St. John's wort oil for wound healing for centuries. Modern research partially validates this use. Studies suggest the plant accelerates wound closure and reduces scar formation. The antibacterial properties may help prevent infection in minor cuts and burns. St. John's wort oil appears in products targeting eczema, psoriasis, and general skin inflammation. The antioxidant flavonoids protect skin cells from free radical damage. Some anti-aging formulations incorporate the extract for this reason. Massage therapists use St. John's wort infused oils for their reported analgesic properties. The oil may help relieve muscle tension and minor nerve pain when applied topically. However, there is one significant caution regarding cosmetic use. St. John's wort dramatically increases photosensitivity. Users applying the oil or taking oral supplements become much more susceptible to sunburn. This phototoxic reaction can cause severe skin damage with even moderate sun exposure. Anyone using St. John's wort products must use rigorous sun protection. The global market for St. John's wort products spans multiple industries. The dietary supplement sector represents the largest market in countries where it is not regulated as a pharmaceutical. Annual sales in the United States alone exceed $50 million. In Germany and other European countries where it is a prescription medication, the pharmaceutical market dominates. St. John's wort is one of the most prescribed treatments for depression in Germany, accounting for over half of all antidepressant prescriptions in some years. The herbal tea market includes numerous St. John's wort products marketed for mood support and relaxation. Traditional herbalists continue to prepare tinctures, oils, and capsules using whole plant materials. The cosmetic industry incorporates the extract into premium skincare lines focused on sensitive or damaged skin. Aromatherapy and massage therapy sectors use the infused oil for topical applications. The scientific research on St. John's wort is extensive, but not without controversy. Over 30 randomized controlled trials have examined its effectiveness for depression. A major meta-analysis published in the Cochrane database systematically reviewed this research. The conclusion stated that St. John's wort extracts are superior to placebo for treating major depression. For mild to moderate cases, effectiveness was comparable to standard antidepressants. Importantly, the analysis found that St. John's wort produced significantly fewer side effects than pharmaceutical alternatives. However, not all studies have been positive. Some large American trials showed no benefit compared to placebo. Critics point to differences in extract quality and standardization as possible explanations. European studies, which typically use pharmaceutical-grade standardized extracts, generally show more consistent, positive results. Research continues into potential applications beyond depression. Studies are examining St. John's wort for anxiety disorders, obsessive-compulsive disorder, and seasonal affective disorder. Some researchers are investigating its potential for menopausal symptoms and premenstrual syndrome. Preliminary evidence suggests possible benefits, but more research is needed. Standardized St. John's wort extracts typically recommend doses of 300 milligrams taken 3 times daily. This provides a total daily dose of 900 milligrams. Extracts should be standardized to contain 0.3% hypericin. Some newer formulations standardize for hyperforin content instead, typically at 3 to 5%. Effects generally require 2 to 4 weeks of consistent daily use before becoming apparent. This is similar to the timeline for pharmaceutical antidepressants. Treatment duration varies depending on the condition being addressed. For acute depressive episodes, several months of use may be appropriate. Long-term maintenance therapy should be discussed with a healthcare provider. St. John's wort is available in multiple forms. Capsules and tablets containing standardized extract are most common and most studied. Liquid tinctures offer an alternative for those who have difficulty swallowing pills. Teas made from dried herb contain much lower concentrations and are less reliable for therapeutic effects. Topical oils are used for skin conditions and should not be taken internally. St. John's wort presents significant safety considerations that users must understand. The most critical issue involves drug interactions. St. John's wort is a powerful inducer of liver enzymes, particularly the cytochrome P450 system. This means it accelerates the breakdown of many medications, reducing their effectiveness. The list of affected drugs is extensive and serious. Birth control pills become less effective, potentially leading to unintended pregnancy. HIV medications can drop to subtherapeutic levels, risking viral resistance. Blood thinners like warfarin may lose effectiveness, increasing clot risk. Immunosuppressants used after organ transplants can fail, triggering rejection. Antidepressant combinations can cause serotonin syndrome, a potentially fatal condition. Heart medications, cancer drugs, and seizure medications are all affected. Anyone taking prescription medications must consult a physician before using St. John's wort. This is not optional guidance. It is a critical safety requirement. Beyond drug interactions, St. John's wort causes photosensitivity. Users become dramatically more susceptible to sunburn and sun damage. Fair-skinned individuals are at particular risk. Common side effects include dry mouth, dizziness, digestive upset, and fatigue. These are generally mild and resolve with continued use or dose reduction. Rare side effects include allergic reactions, rapid heartbeat, and skin rash. St. John's wort research has focused primarily on adult populations. Adults with mild to moderate depression represent the most appropriate candidates. Those with severe depression should seek psychiatric care rather than self-treating. Middle-aged and older adults may benefit, particularly those reluctant to take pharmaceutical antidepressants. Young adults can use St. John's wort, but should be monitored for response. Adolescents and children should not use St. John's wort without medical supervision. Safety and efficacy data in pediatric populations is insufficient. Pregnant women must avoid St. John's wort entirely. Animal studies suggest potential risks to fetal development. The herb may also stimulate uterine contractions. Breastfeeding mothers should avoid it as compounds pass into breast milk. Effects on infant development are unknown. Individuals with bipolar disorder should avoid St. John's wort. It may trigger manic episodes in susceptible individuals. Those with schizophrenia or other psychotic disorders should not use it. Anyone scheduled for surgery should discontinue use at least 2 weeks prior due to potential anesthesia interactions. St. John's wort occupies a unique position in the landscape of mental health treatment. It is perhaps the only herbal remedy that has been rigorously tested against pharmaceutical antidepressants and found comparable. The evidence is not perfect, but it is substantial enough that governments have approved it as a medicine. This small yellow flower forces us to confront uncomfortable questions. Why do we assume that synthetic molecules are superior to natural ones? Why do we dismiss thousands of years of traditional use until modern laboratories validate it? The science is clear that St. John's wort contains compounds with genuine, measurable effects on human brain chemistry. It offers millions of people an alternative to pharmaceutical antidepressants. For some, it works as well with fewer side effects. For others, it provides an entry point to addressing their mental health before committing to prescription medications. But it is not without risks. The drug interactions are serious and potentially life-threatening. The photosensitivity is real and can cause significant harm. And it is not appropriate for severe depression, which requires professional psychiatric care. St. John's wort is neither miracle cure nor worthless weed. It is a powerful botanical medicine that demands respect, proper use, and informed decision-making. The monks who named it after St. John believed it could chase away darkness. Science has shown they were not entirely wrong.